For more on the analysis of trying to figure out what went on today and what may yet happen, let's turn to our own Lawrence O'Donnell, former Chief of Staff to the Senate Finance Committee, now contributor to the Huffington Post, and of course a regular with us here on Countdown. Good evening to you, sir.
Good to be here, Keith.
What is the deal with Snow? Did she do this so she can stay at the table, or so she could get fawned over by Charlie Gibson on World News Tonight, or get reelected? And what is the Democrats' fascination with her one vote? Does she have more than one vote?
And get a shout out for the President of the United States today.
Yeah.
Well, she became, by the Democrats' definition, and certainly by Chairman Baca's definition, and in effect by the President's definition, the most important vote in the Senate and the most important vote in that committee. And they got that vote. She definitely cast her vote that way so that she could remain relevant to the process. There's many other lower visibility pieces of legislation where this stuff happens all the time, where a senator says, okay, I'm not crazy about this. I don't really like it the way it is right now, but I'm going to vote it forward so that it moves forward to the floor, and I may vote against it on the floor, or I may vote against it in final passage. And there are plenty of times when senators do that. Vote for something in committee, vote against it on the floor. So the suspense continues with Olympia Snowe. By voting for it today, she's just continuing this suspense out onto the Senate floor.
The study yesterday, PricewaterhouseCoopers, it would have been a perfect opportunity to respond to this by saying, essentially, F you to the Republicans, to their insurance cartel friends, and really say, all right, it is a line in the sand, or at least it's the sort of the Ron Wyden version of the line in the sand, virtually such, for a public option. Is there anything today suggesting that that opportunity is being exploited?
Boy, they blew that chance. It was sitting right there for them to do. CBO basically sits around and does a lot of educated guessing about what's going to happen when legislation is enacted, and they try to predict what different players in the legislation will do. This is the biggest player in this legislation, the health insurance companies, coming out and saying, hey, CBO, this is what we promise we will do. We will raise rates this much. In other words, we will raise rates even more than you have projected we will raise rates. Now, CBO, along with Pricewaterhouse, CBO does say that premiums will go up under the Baucus bill, not down. They will go up. The argument now is just how high up will they go? And the insurance industry is promising us, study or no, forget the study. The study doesn't matter. The industry, the people who set the prices, as you have said, have promised us this is how high we're going to go because of all of these taxes they're putting on us.
Yeah, to borrow Mr. Hitchcock's phrase, that study is the MacGuffin. It doesn't matter what a MacGuffin is. It's the fact that the box is there. Does that mean that it's likely that we're going to see something like the trigger option instead from Snowe, or the opt-out compromise from Carper and Schumer? Is that going to be the big advance when we're all said and done here?
Well, we're certainly not going to see anything that Olympia Snowe doesn't like. The president, in effect, made that clear by singling her out. He could have said something about Jay Rockefeller today, who's the chairman of the Health Subcommittee, who's been on this subject longer than anyone else in the Senate. He could have done that. He didn't. He picked Olympia Snowe to say, in effect, I'm with you, and what you need is what I need. And so she's only available, it seems, for a vote on a triggered version of the option. And so that's, at the moment, it looks like the best the Senate can get.
Yeah, Senator Rockefeller has been up front in this battle with the shield and the axe going at the other side. But what is that? From Senator Conrad? They used to argue against the public option by saying it couldn't get 60 votes in the Senate. Today, the senator said that the public option was a non-starter for him for this entirely new reason. Is he now coming up with reasons the way the insurance industry comes up with reasons? I mean, well, it's another day. We have to have another new reason.
Well, when he was saying you couldn't get 60 votes, what he meant was you can't get mine.
Yeah.
But in fact, to be fair to Senator Conrad, he has said before that North Dakota hospitals would have to shut down. Virtually all of them would have to shut down if they were getting reimbursed at the Medicare rates. So what he is saying is he's against the strongest version of this as proposed by Jay Rockefeller. There are other versions of public option that he might be able to go along with, but it's really that specific kind, and he actually mentioned that to me personally when I saw him in Washington the last time I was there. He hasn't been, highly visible about this particular reason, but he has been on the record about this reason before.
It's a valid one, and deserves something in the final bill that protects him and any other state that is like it in that situation.
That's right, Keith. You could tailor it to fix it for him.
Lawrence O'Donnell, the Huffington Post, MSNBC. As always, thanks for helping us try to understand this continuing nightmare.
Thanks, Keith.